Go. All right, sorry, for posterity, we're going to have this recorded. All right, so like I said, the CDC Yellow Book, it's published every 2 years by the CDC. They give the most recent guidelines for travel health. It's kind of the gold standard. They're going to have destination recommendations when you go and actually have your travel clinic visit, which we'll talk about in a bit. This is where they're getting their guidelines. There's an actual app that you can download if if you're into infectious disease or whatever, but it's also available online. Also, plug, I have to do this. We have our travel handbook that we put together through the GHA that we hope all of you look at it. It's kind of pulled together a lot of what's in this talk and kind of boiled down, condensed the Yellow Book a little bit for the sites that we travel to. Okay. And that should have gone out on the course website as well. You guys all should have that. In general, the timeline, now that you guys are kind of coming up to it, obviously, if you don't have a passport, you're going to need a passport. You need to make sure that it's up to date and it's going to be valid up to whatever they want. Most countries will say about 6 months after the end of your travel, so make sure that's usually where people get in trouble, where it will expire too soon. And then pay attention to your budget, know how much money to expect to prepare all your project materials, which is what we're doing currently. And then in the next 3 months, which is where we are right now, you guys should be looking at flights, prepare your visa if you need it, finalize the itinerary with your in-country contacts, and then you should be preparing a pre-travel medical consultation. One thing I want you guys to do while you're here today, if you're not set up with the STEP program, the Smart Traveler Enrollment Program, this is done through the Department of State. This is it's a free service that basically you sign up, you give your passport number on it and enroll and say, I'm going to be in this country from this time to this time. It takes a couple of minutes to sign up. They will give you any travel advisories. If something occurs while you are abroad, they will know that you're in the country. The nearest embassy will send you this email saying, this is what's going on. It's a very, very smart thing to do, and I definitely recommend that anybody that travels to do it, okay? Regardless of whether it's for academics or just personal reasons, you never know, and it's good to have the embassy know that you're in the country. Now, locally, travel clinics that are in the area. These are the two, depending on where you get your health care through. If you're a Wayne State student, the Wayne State Campus Health Center, they do an excellent job. That's where I usually go. They give you it's a comprehensive clinic, immunizations, education, etc. Malaria prophylaxis. Henry Ford also has one in Novi. If you're through Henry Ford or HAP or whatever, that's another option as well. This is another thing you can do. I think they have their email address as well if you want to email to try to set up an appointment. What they want to know is where you're traveling, and if you have that set up, give them a call, get your date, and get that started. Okay. So now that we've covered the stuff you can do today by the end of class, let's talk generally about your health while traveling. So the disease risks that you have when you're staying abroad, this is the most recent one from Travel Medicine Handbook. We generally are worried about things like malaria or, et cetera, but in actuality, the things you really need to worry about are traveler's diarrhea. This is a logarithmic scale. Influenza, dengue is one of the most common. Animal bites with rabies. Malaria is up there, especially in Africa. But hepatitis A, typhoid, those are the things that you should be equally concerned about. And if anybody did your reading and did your homework assignment, you know that the most common cause of death amongst U.S. travelers abroad, other than natural death. Anybody remember what that is? Traffic accidents, exactly. So if there's anything that's going to seriously injure you or kill you, that's the thing to be very careful about. Okay, now the fun stuff, immunizations. All right. The recommendations obviously are to have your standard immunizations. If you don't have them, you should have them. Tetanus, diphtheria, pertussis, MMR, hepatitis B, influenza. You should have that as well. Pneumococcal disease, some of us, polio as a standard immunization. But the unique ones that are generally recommended are going to be hepatitis A, the typhoid, the IM, or the oral. The oral is going to last a little bit longer, so if they have that, it takes more time, but it's going to last longer. You don't have to get hit with shots. You see the 4 doses here. Some locations are going to require Japanese encephalitis, or some places will even recommend cholera if you're traveling for a significant amount of time, but generally not. And the big one that's going to prevent you from being able to travel is yellow fever. Okay, it's required if you're traveling to an endemic region. If you've recently traveled to an endemic country. When you return, you're going to need it, and having a passport from an endemic country will require you to have a yellow fever immunization. This is the most recent recommendation, so if you're traveling to any of these countries, take a look. It's on the yellow book as well. They're going to want this. And the card that you're going to get will look something like this. If you're traveling to a country that requires it, or you're going to have a layover in a country that's endemic yellow fever, they're going to want you to have this when you return or when you move on to the next port of entry, okay? Cool. Any questions thus far? No? Cool. Other ones, meningococcal, if you're traveling for Hajj or anything like this, if you're traveling into the meningitis belt, this is another one that is going to be recommended, okay? So be prepared for that, but majority of people here will not have to have that, or they've already had it when you went off to college. And then polio is recommended if you're in Pakistan for greater than 4 weeks. Any questions about that? Okay. For malaria and dengue protection, there are 4 stages that they look at. You look at clothing. So we want you all dressed up like this. We're going to hand out the nets in the back. Great, everyone's paying attention. They want mosquito repellent for 20 to 30% DEET, insecticides, pyrethrum based, so you can spray whatever it is that you're going to, like, your backpacks or whatever. You can have that, or obviously bed netting. This is going to help you a lot. It's going to keep you from being up at night more than anything else. It's comfortable as well. And bring floss is my recommendation for hanging these things up. I always bring like the little 3M hooks. Okay, and like those nice little things you have in dorms or whatever. Have one of those, have a few of them for whoever you're traveling with, and then bring floss, because that's going to be the best. Instead of bringing like nylon cord or something crazy to try to hang this, floss does an excellent job, and you guys all should be flossing anyway, so cool. Malaria prophylaxis. So discuss this with your PCP or your travel clinic when you get there. That's something that's going to be a major discussion, okay? There are many options that you have, okay? Malrinone is going to be one of the most common. Chloroquine you can do if it's not resistant. It's not a commonly prescribed drug. Doxycycline can be used as prophylaxis. Can't be used for treatment, but it's going to have sun sensitivity, so it's not the best option. Mefloquine is a really great option as well, but it can cause psychiatric side effects. So if any history of depression, or it can induce these symptoms as well. So be aware of that if you have this medicine. Just be cognizant, because we talk about it a little bit, but it's more frequent than you would think. And then primaquine as well. And then first aid. Okay, so bring any medications that you take on a regular basis. That makes sense, okay? What you would also expect when you go to your travel clinic is a prescription for antibiotics for self-treatment of either moderate or severe diarrhea, okay? Not just simple loose stools, but if it's moderate, severe, 8 or more bowel movements a day, then you should be taking this, okay? You, of course, need malaria and prophylaxis. You need medicine to treat altitude sickness. If you're heading to Nepal, then that's something you should consider and talk about. If you have known allergies, obviously you want to bring an EpiPen, okay? Any diabetic testing that you have, if you need, obviously you should be bringing any needles or syringes if you need, if you have injectable medications. Some travel clinics will give you like a couple of needles and a syringe in case you ever need one. That way you know any hospital you go to, this is going to be a clean needle. Some places do that. They should give it to you in a prescription bottle that has your name on it and has what this is and what it's for. And then bring a personal medical record. Okay, this is something that's very, very, very useful. God forbid anything ever happen, but if you have any diseases, you should have this written down. That way, if you don't speak the language well enough, or if you can't speak for yourself or anything were to happen, you have this on you. That way, it's ideally in the language of the country that you're in. That way, they know what medicines you take, allergies you have, etc. This is also in the GHA handbook. Okay, you can find that. It's the International Association of Medical Assistance to Travelers. This is an excellent website. Take a look at it. You have to register, so that's a bit of a pain in the butt. But they do an excellent, excellent job. They have a list of hospitals in the regions that you're traveling to that they recommend, that take the insurance that you have. It's just very, very good. And this is a great option for having a medical record. Okay, so if you don't want to go find one, this is already in your handbook. And like I said, with personal medications, bring enough of your medication to cover whatever's in the trip, and then if it's an essential medicine, if it's something that you absolutely need and you'll get sick if you didn't have, I would bring double, okay? Just in case something were to happen to one. pack your medications on your carry-on baggage, of course. You do not want to have your insulin or your EpiPen be lost in your luggage, okay? And keep a copy of your prescriptions. So ideally, keep your prescription bottle. That way, at your port of entry, if they say, whose is this? This is yours. It has your name on it. Who has the prescriber? You'll be set if you do that. But also be very, 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 very careful with some of the medications that you would take. I forgot what it is, Flexeril, or some of them, they're considered a narcotic in some countries, but not in others. So be cognizant of that. That if you're bringing in some medications, especially pain medications, you may get in trouble. I would pay attention to which are controlled in the destination of travel. Okay. And then, of course, your over-the-counter medications that you want to have with you in case more simple illnesses occur. Pain relievers, antidiarrheals like Imodium or Pepto-Bismol. Okay, like oral rehydration salts is a good option if you have access to that. They're generally cheap. Decongestants are nice. Sleep aids for if you're traveling a far distance. I find melatonin does a really good job to help with jet lag for me. Sunscreen, of course. Hand sanitizer if you'd like as well, gauze or band-aids for minor scrapes, etc. And then, of course, bring your contact lenses and prescription glasses, both. You guys should know this stuff. For health insurance, you have many options, okay? Check with your current insurance carrier. They probably have an option to say, okay, if you're traveling internationally, we have a plan. Just reach out to them and they'll show you that. If you're a Wayne State student, they have Geo Blue, which is through Blue Cross Blue Shield. International SOS is extremely common. That's another one you can reach out to. They provide what's the word I'm looking for? They'll be able to not provide you health care in country, but they'll be able to get you out of the country to receive health care. Okay, so they'll be able to go pick you up and bring you back. And then the U.S. State Department also has many options. At least for now, we might be getting rid of those soon. Who knows what the heck's going to happen? And then travel documents. So you want to, of course, check for and apply for visas and check on the U.S. Department of State website for U.S. citizens. And then, like I said, ensure that your passport is going to be active through the travel and then generally 6 months past, but each country is going to be different. And then I'd keep a physical and a digital copy available. For me, I use Google Drive, Dropbox, something like that. Even if you just email it to yourself and email it to your spouse or friend or emergency contact, you want this readily available and ideally electronic as well. That way, if something were to happen, I've lost my passport, I need to go to the embassy, I just say, if I can check my email, I can get it to you, or have it on your cell phone if you have data availability, something like that. You need to have a secondary option if you lose your passport. Okay? Having a physical copy is nice, having an electronic copy is excellent as well. And then, like I said, send your copy to the emergency contact. That way you know that they reach out to them, they go, oh, no, I have my passport, their passport, here it is. For communications, when you're abroad, it's becoming a little bit easier. This used to be a larger issue. Now it's not quite as big. You have Skype, you've got FaceTime, you've got Google Hangouts, you've got many, many options to use for communication, with your colleagues, or if you want to find a way to find our class while you're traveling abroad. Check with your carrier for international options for cell phones. If you're T-Mobile, they have international roaming or whatever, but check that many of them have international options that are quite cheap now, and you can consider that. Consider getting a SIM if you're going to be having any considerable stay. And if you're traveling to India, if you get the e-visa, they've partnered now and they have a SIM card that they give you with the visa. So it's like $1. They only have like $1 on the SIM card, but then you can add money to it when you arrive, and it's a really great option. I think it's great. Calling cards are another option, of course, and then the other thing is consider a VPN if you're traveling to a country that has more restrictive internets. It's going to help you with, if you use Gmail and you're traveling to China or something like that, you're still going to have access to it. So be aware of whether that's going to be an issue. Like if you're in Laos right now, Dr. Kaufman's in Laos, be aware of that, okay? And that's I use VPN as well, but they're free options. Take a look. For cash, contact your bank if you plan to ever travel internationally and you want to use your debit card or your credit card for whatever. You plan to get a hotel or something. Let them know you're going to be traveling. It takes a few moments, and that way you're not going to just suddenly have it blocked off. Ensure there are no international fees on your credit card or debit card, whatever you plan to use. Obviously, you want to be aware that if you're going to use that, you're going to get a charge or not, whatever. And then, of course, have your budget. Be aware of how much cash to keep on hand. And it's always nice to have some cash that's on you, some cash that's stowed away somewhere else. And when you arrive, when you go to get your currency, small bills, of course, are generally useful. Okay. Any questions thus far? Any tips that anybody else would get that I haven't covered thus far? No? Excellent. And so extra tips that I have for everyone who's in WHSO. How many students are here? Okay, so raise your hand. I can't quite see. Okay, a handful of you. So this is something we've added for all of you guys. So you should know the basics of the language and culture before you travel. Okay, beyond the ability to get around and say hello, it means something. You're going to find people are much friendlier if you can say hello in their language, and it's going to mean more to you to be able to say hello and hi, and how do I get somewhere? Knowing things like thank you or how to count 1 to 10, something like that's going to help you a lot. And a translation app, now we have cell phones where you can use Google Translate and download the language and you're good. And then I find that if I set my watch, if I'm traveling anywhere that's going to be any significant distance away time zones, if you set your watch when you get on the plane to your destination and start preparing as though that's the time that it is, it's going to help with jet lag. Okay, so when you get on the plane, it's 9 o'clock here in Detroit, but if it's 9 a.m., set your watch so it's 9 a.m. that way you think you are aware of what you're going to be getting into. Drink plenty of water. This is from Maroon. Drink plenty of water to avoid the flight hangover. You're going to be dry. You're going to be, the next day almost invariably, you're going to have a headache because it's so dry, you're going to be so dehydrated. Try to keep hydrated. And then I usually bring a little luggage lock. If I have a backpack, one of those little things that are this big, bring that. That way if you're walking around in a big city, you have a little lock on it, okay? That way it doesn't just go getting opened up. And that's really about it. Any other tips that you guys have as far as pre-travel, or any questions that you have for me right now? No? Silence? Excellent. Okay. And the last thing, of course, have fun. Okay? You guys should have fun. You're going to do great. You're going to do great things. And that's all I've got for you right now. Cool. Let's take a few minutes break. We're a little bit I flew through this. So let's take a few minute break. 5-10 minutes. Dr. Cortis will be the next lecture talking about actual travel safety once you travel. Okay? All right, cool. Thanks. Oh, there it is. Okay. Okie dokie. So, totally good. Yes, okay. All right. We're trying to move on, but Ijeoma would like to say hello to everybody. So I'm super, super happy. Ijeoma.
Hi, everyone. Okay. Do we have any new folks? So where are new people, our new cohort? Raise your hands. Okay. Hi. So good to see you. You look beautiful. So I just want to officially introduce myself to the new people and reintroduce myself. Allow me to introduce myself. My name is No, I'm just kidding. So I'm Dr. Ijeoma Nodem-Opara. I'm co-executive director with Dr. Christiana Kaufman, who is live in Laos doing her thing. Her other half is here doing his thing. But I have been away because I was busy having a baby. And so she's 3 months and doing well, healthy, thank God. And I'm back to work now. I'm really excited. And so I just wanted to welcome our new cohort and re-welcome our former cohort. You guys are not old, you're just seasoned. So our seasoned cohort. And, and looking forward for the rest of the year and doing big things and awesome things. So, yeah, that's it. I'll just be hanging out in the back, and feel free to stop by, say hi, tell me what I've missed this past 3 months, because I know I've missed a lot. All right, take care, okay? Thanks.
Hi guys, my name is Amy Cortis. I'm a pediatric emergency medicine physician at Children's. I went to Wayne State. I was part of WHSO and I had the opportunity to travel through WHSO. So I'm going to share some of my personal stories today. I know the topic is a little bit dry. We're going through a lot of slides and giving you a lot of information. But I'm going to share some of my personal experiences, and maybe it will inspire you to follow the advice that we're providing today, because we all learn from our mistakes. And if you have questions today, please stop me at any point in time, all right? And if you have anything to add or have advice for the audience or people traveling, I encourage you to stop me so that you can share those things as well, okay? I know, again, this isn't the most interactive discussion and session that we've had, but we want everybody to know that we appreciate and need your input, okay? Whoops. All right, so first we're going to talk about arrival and customs, right? Always a fan favorite. So when you get to arrival and customs, when you're traveling to your destination, you always want to carry the information with you on some paper, okay? Technology is great. We all have cell phones, but you know what? At the moment you need it, your battery's going to die, your charger's going to be dead, like you're not going to have access to electricity, okay? So have things written down on paper. You want to make sure you have the address of where you are staying, and because you're going to have to fill out the form when you're on the plane. So you need that contact information, you need the address. You need to have on hand your passport, your visa, any details of the medications being brought into the country. So like Jeff said, it is really, really important you keep all of your own personal medications in the original pill containers, because they will get taken away at customs. I've seen it happen. You want to maintain control of your bags. So one thing about bags that I want to bring up now, because it doesn't really fit into the rest of the presentation, is make sure you know what the expectations are of where you're going and how much you're allowed to bring with you, okay? I went to India when I was a first-year medical student, and we went for 6 weeks. And we showed up with suitcases that I probably could have fit in, and they probably weighed about 50 pounds because I was going for 6 weeks and I didn't really know what I needed. Yeah, well, they didn't fit inside of any of the cabs when we got to India. Okay, that was a little bit of a problem. So you had 6 of us and 6 bags like this. So they actually we had to get another vehicle. So we don't necessarily take this information to heart, but when we're going to other places and we show up with a ton of stuff, they can't accommodate it. Last year, I went to Nicaragua with the medical students. The reason there was a flight restriction, or the reason there was a restriction on the weight, was because we had to take a little puddle jumper. We took this plane that carried 12 people, and they had to have the weight balanced out appropriately. So people did show up with big, huge suitcases. And again, that messed up the weight, so we had to take 2 different flights. So when they give you these restrictions, it's not just because they're giving you a hard time and don't want you to bring a lot of stuff. Think carefully about what you're going to need while you're there, and make sure you take what you're going to need. I was so impressed. One of the colleagues on the trip that when I went to Nicaragua, she showed up. She's an ER doc from Henry Ford. Megan showed up and she had one little handbag. And that was her stuff for the week. And she had everything she needed for the entire week. I don't know that I could have done it. I'll be perfectly honest with you. But this is really something that's important and that you need to consider. I think sometimes as Americans, we're just like, okay, whatever, like I need all my stuff with me. Well, when you show up, everybody's going to know you're an American here with all of your stuff because you brought it all with you. Okay, so think carefully about that when you're packing. Be prepared for a discussion with the customs agent about any of the medications, expiration dates. So have all of your things with you. And then know how to access the U.S. Embassy site. So again, Jeff talked about this too. Make sure your family members know that you've registered with the embassy, and make sure that you're aware that you have access to this site as well. All right, let's talk a little bit about transportation. So we touched on this earlier and it came up in your article. The #1 cause of injury or death for US citizens in foreign countries, road traffic accidents. So my first trip, when I went to India, I didn't know how to explain the road conditions to my family. And they were like, basically we came up with like organized chaos. Okay, the cars were just all like merging on at the same time. Nobody was stopping at stoplights. Nobody was stopping at stop signs. I thought I was going to die on more than one occasion. Okay, so I'm being perfectly honest with you. What were the other forms of transportation that I had access to there? Okay, we had cab. There was a cab. We had auto rickshaws. And it was interesting because we considered some of those to be sketchy. Some of them were better than others, right? Whenever because I was a white person, I stood out like a sore thumb. So anytime I got into anybody's auto rickshaw, they all drove straight to the gas station to go fill up to let them know like that they had tourists with them. So you need to be careful about how you're traveling and where you're going and the time of day. Okay. So first of all, same rules apply as here. Wear your seatbelt. Okay. Do not travel by bus or car at night if it can be avoided, okay? If it's part of your travel itinerary with your group and it's the plan, okay, that's what it is. Don't ride motorcycles. Did you guys all hear that? Something happens when we all go to another country and we get like really excited and we get there and we're like, oh, that's so cool. They're all driving motorcycles here. They're not wearing helmets, nothing like that. Yeah, no, that's a bad idea. Okay, nothing good is going to come of that. If you haven't ridden a motorcycle here, the chances that you're going to be safe riding a motorcycle there are pretty slim to none. Okay, so don't get hurt. Don't get on a motorcycle. Ride only in marked taxis that have seatbelts. All right, avoid the overcrowded, overweight, or top-heavy buses or vans. Okay, it might look cool, but again, we're thinking about your safety. And then be alert when crossing the street, especially where people drive on the left. So it can be a little bit of a culture shock. It's a little bit different. Again, we want you to be smart and we want you to be safe and have a good time. Okay, food is always a favorite. When I went to China as a resident, I got to spend a month in China and we stayed with the family and it was really, really cool. And it was right after the Olympics. So prior to going to China, I was like, watching the Olympics, I was watching all the shows on TV about all the cool food and the street food and blah, blah, blah. So I had like some insight before I was going to go. So the advice that I got from my mentor is he sat us down in his office and, we went over all of the logistics for the trip. And he said, do not eat street food. Just don't eat the street food at all. I was like, okay, no problem. So we were very cautious. And, there were a couple of situations where we were worried and upset that we offended our host. She tried to buy us something off of the street, and it clearly was street food because we were right there. We were like, no, we can't eat that. We might get sick. So the last day of the trip, someone woke up a little bit early, and Yang woke up early in the morning. She was one of the nurses at the hospital, so she woke up like an hour before us every day, and she got breakfast ready. Not that we needed her to, but like she felt like she needed to do this because we were the guests in her home. And on the last day, we realized that she was walking downstairs every single morning and she was buying our breakfast off of the street and then bringing it right back upstairs. And we were eating street food every day. Again, so we did really well, okay? And nobody got sick. But again, you want to pay attention. So when I was in China, that's what people did. They walked home from work and you bought your groceries or you bought your food on the way home. They knew that we were coming and they were aware that we were coming, so they did have a cook. Some of the issues with hygiene and things like that were a little bit different than they are here. But again, you want to know when you're with the trips with WHSO, we've worked with these organizations so they know that we're coming and they want to make sure that you're not going to get sick. So we're going to go through and we're going to talk about safe foods and not so safe foods. All right, what do you guys think? What up here is safe and what's not safe? The bottled water. Bottled water safe? Okay. What do you want to make sure you know about your bottled water? If it's sealed, right. Okay. That's all you got. That's great. Okay. Boiled coffee or tea, right? Because it's boiled. Pretty safe bet, right? The canned good. Okay, why? It's sealed. It's coming out of a can, okay? Like you're opening it yourself.
The can of Coke, because nobody can live in that,
Excellent. Okay, so another canned good, right?
I would even honestly go with the produce. I feel like they wouldn't. I would eat the produce with water.
Because of the water. Okay, so tell us a little bit about the water situation with the produce and what your concerns are.
So my concerns would be for the salad, those like berries and like the popsicle. Even if the fruit is okay if it's washed with dirty water or the ice is dirty water, like even with that can of Coke, if someone put ice in it because it's hot, and with the salad, particularly the a garnish that could be washed with dirty water, because that's not safe. So I would be hesitant to eat that unless maybe you washed it with the bottled water or boiled water. I might eat the banana because like the exterior of the banana is.
You can peel it, right? You can take the peel off. Okay.
Other stuff, I probably would.
Excellent. All right. Any other comments? Who's been sick on vacation before? What was it? What did it to you? You don't know. Okay.
I will say that Amy's story was kind of an outlier, like nothing happened to them. I'm from India. I've been here only 6 years. Your GI biome or biogram changes pretty quickly. Almost died on my recent visit to India. I pulled off the street. I'm from India. I've been out of India only like 5 or 6 years. So that's it's good that nothing happened, but then the opposite spectrum is like, okay, please have to do it.
And to add to what Ron said, my parents are from India, but I'm from here. So we can't handle any of the stuff. He can maybe handle a little, but our biome or GI flora can't handle any of those delicacies. And like Amy said, you do risk being rude to your host or your guests, because they might prepare something special, or they might have looked up like, oh, what do Americans like to eat? They like to eat salad, and then you're like, oh, kidding, I can't eat that. I probably offended some people, but at least I didn't eat that.
And again, though, I think that that's a great point, right? So we want to be sensitive to these things. And so we actually did sit down with our host after, and we explained to her, we were like, oh, Yang, we're really sorry, but, we're going to get sick if this happens. And then actually one of the people in our group did get sick, and he was in bed for 3 days. But, there were other things that happened during the trip that we all enjoyed together. Like tea time was really special. We could all have tea time together. So I think at the end of everything, that we all left with that special memory of every night we would sit down for tea, we would have tea together. And so there were a lot of good things that came of it, but you just have to be open and communicate the best you can and be respectful in the way that you do it. I did try street food in India. It was at the end of the trip because I was feeling pretty good and someone said I really had to try it. Yep, enjoyed it for the hour that I ate it. And then I didn't get to go to the wedding that night because I was stuck back in the room and I thought I was going to die. All I did is lose about 5 pounds and got a little bit dehydrated. But again, right, we've all done these things and you're in the moment. You're like, oh, but I'm here. I should try this, Again, we want you to be safe. We want you to have a good time, okay? So food is a really big one. So great, we touched on a lot of things. So fruits and vegetables can all look very appetizing in other places, right? And sometimes they'll look better than they are here, but you want to be careful, especially with the water. So I know when I was in Haiti, if we did have lettuce or fruits and vegetables, I know that they were washed appropriately. So it's okay to ask those questions too. How were these things washed? Is it safe for me to eat? So a lot of these organizations that we're working with they know and they understand what your GI system is going to be able to handle. So they'll make sure things were prepared correctly.
But also if you have certain diet restrictions, it's kind of hard to ask some people it's kind of if you have something specific is this specific ingredient in it? Because it's some people
Perfect. Okay, so these are things that you want to take care of ahead of time, right? If you have the ability to do so, you want to make sure that if you have special dietary restrictions for whatever reasons, that people are aware and that they can accommodate you when you're there. Maybe you're going to have to show up with a jar of peanut butter. Maybe that's what you're going to live on for the time that you're there. But if you know that ahead of time, be prepared. I always take oatmeal with me because I can mix it with bottled water, the little packets of oatmeal. I take my, whatever kind of bars. And then tuna fish is another great protein source, peanut butter. So again, think about things like that are in packages. Maybe you're not going to like the food or maybe something like that's going to happen. So you have a backup plan, okay? But these are things that you can do ahead of time and you can prepare and ask questions about what kind of food is going to be served and what you're going to come in contact with.
And let me just add something too, because we have a saying, a hungry woman is an angry woman, right? And so it's easy, while you're here sitting comfortable eating on the bars that I'm totally fiction. But I have been in
situation. I remember where my colleague, a young lady, we're both younger, and where I remember we're in Ghana, and she's vegetarian. And I don't know if y'all have watched the movie, My Greek Wedding, where her fiance, she's Greek family, fiance comes in, and she introduces the fiance to the auntie and says, auntie, he's vegetarian. And her auntie says, no problem, I make lamb. And trying to say that, some of the concepts are used to hear, oh, gluten-free, I'm vegan, I'm vegetarian, which, it's great, but those concepts may not necessarily be recognized in the way that we expect them to be recognized here, elsewhere, and that could be anywhere in the world. And so in this restaurant, she asked vegetarians, they were very happy to oblige. Of course, when they brought her dish, there was all kinds of meat products in the dish, and she wasn't very pleasant about it, right? Because this restaurant, she was paying money, so she had expectation like we have here. Right, I paid for my service. It better be what I'm asking for. She wasn't very pleasant about it. But I accused her like, a hungry woman is that much. I think she was pretty hungry. And when she did not get what she needed, she acted out of that. So I just want to kind of present that portion of it, that to emphasize the point that we made. Preparation is key, and having a backup which she did not have, especially if you have dietary restrictions, have some backup, because those ideas of restrictions, I traveled to Haiti. I have some dietary things at the time that they were more significant. And again, very hospitable, people bend over backwards to accommodate. It's just not the same idea you have. And so the food I needed was never ever there, and it was something that had to be done. So flexibility, preparation is very key, and then just always keeping a good humor about things, because people generally are bending over backwards to the best of what they understand your needs to be, but it might not necessarily be yours. So just kind of check that. I just want to bring that out because it's nothing about that here, but when you're there, you're hot or cold, you're tired and you're hungry, that other, Sasha Fierce can come out from the other side, So just be mindful of that. Is that okay?
Absolutely. No, thank you. It kind of brings to point another experience that I had. So I did a mission trip to South Africa, and it was for 2 weeks. And before we went, we were prepped. But, some of these places, and I've traveled actually within the United States and done some service trips where there wasn't enough food, or you clear your plate. So we're so used to wasting a lot of things here. So make sure you understand what the cultural practices are. When we were in South Africa, you put on your plate what you were going to eat. If you didn't like it, you still ate it and you still cleared your plate. So a lot of times that meant some of us would take just a little bit of something to see if we would like it, and we tried it. And if we didn't go back for more. But it's really important to understand, I think we get so used to wasting things, and there's lots of excess here. There might not be enough. And, again, people are bending over backwards for you. So we want to make sure that we're respectful of that and cognizant of that. Okay, so we kind of talked about some of the risky versus safer foods. You got your uncooked vegetables that are riskier, foods from street vendors, anything raw or rare, fountain drinks, because again, it can have the ice in it or mix it with water that you don't know where the source is. Flavored ice or ice pops, when it's really, really hot, you really, really want one. But yeah, that's probably not such a great idea. Maybe go for something in a package. Bushmeat, ice or drinks, and then food served at room temperature. So fruits and vegetables are okay. But make sure that you've washed it or you've peeled it. Okay, so oranges have a nice skin, you can peel it. The same thing with apples. You can take a potato peeler with you when you go somewhere else, and you can peel apples, right? You can peel apples and you can peel pears. Food that is cooked and served hot is better. Hot coffee or hot tea, again, because it's boiled. Water that has been disinfected. Ice made with bottled or disinfected water, and then water, sodas, or sports drinks. So another kind of funny story I have from my trip to India, there were 6 of us, and 2 of the people in my group were actually born in the area that we traveled to. So they were like, okay, we'll be okay. But they had been in the United States for a long time. So we were working with the doctor and we were observing in his clinic, and we said, could we please stop so we can purchase some more bottled water? We're running low on water, so we'd like to stop. So this doctor says to us, well, I have water, like I filtered it and prepared it myself. So you don't trust my water source, So Vamshi, who is one of my classmates, said, okay, guys, take one for the team. I'll drink the water, so that he doesn't get offended. And Vamshi was the only one who ended up in the hospital getting IV fluids. Okay. So again, just the point that you need to make sure we're not used to these things. So bottled water, bottled water, bottled water. Okay. Again, make sure that the glasses, cups, silverware, everything are dry and they're still not wet from being recently washed. It's unlikely that washing in restaurants is done with treated water. And a lot of these places that you'll go, the organizations that we're working with know which restaurants we can go to. So again, if you're left to your own devices, trust your guides because they're going to tell you where are the safe places to go. This eat with the right hand only is a cultural issue. Does anybody want to talk about this a little bit? Anybody want to share? Okay, so tell us what's the rationale? Can you share with what's the rationale behind it?
I don't know what the rationale is, but with your right hand only, not with your left hand. I don't know what the logic is, but it's just something I'm used to all my life, and I think it's an Eastern culture thing. So if you're going anywhere east, try not to eat with your left hand. Probably try not to eat standing. I think that's one too. I don't know. But I'm sorry. I just do it all my life, but it's on the line.
Typically, left hand is used for washing yourself when you're in the bathroom, wiping yourself. That's what I refer to.
Did everybody hear that?
Use your right hand, at least in South Asian culture, that's what I know.
Right. So it's hard if you're left-handed and you're constantly using your left hand to eat. So that would be different for you from the norm. I saw another hand in the back. The same thing. Okay. So what about eating with hands? Yeah, you eat with your hands, right? So you might be in a place where silverware is not available. So again, make sure that you're aware of these things, or you might be using chopsticks and don't know how to use chopsticks. So again, make sure that you're aware of what could happen.
And then a lot of there's a lot of shared plates.
Absolutely. So here it says, be mindful that it's frequently unacceptable to eat food off of someone else's plate. But when I was in China, everything was in the center of the table, kind of like on a lazy Susan, and you just kept spinning it and you would grab off of it what you wanted. So again, depending on where you're going, make sure you understand what the expectations are. We never had our own plate. I mean, we had our own plates sitting in front of us, but we were constantly eating off of the center of the table.
It's the second point there with the restaurants. So if you're ever traveling, I would be cautious, exclusive of a trip like this one where it's with certain organizations, because sometimes the guides take you to a certain place where they have a deal with. But I would say if you're ever in a pinch, go to the American chain, which just sounds awful. Like, oh great, I went all the way to Asia just to eat at the McDonald's. But those are they're held to the American standards. At least it comes pre-packaged. It follows American rules and such. There's no guarantee you won't get sick, but I would trust that hot food from one of the American chains versus whatever your stuff.
But also know that the McDonald's might taste different, right?
Right.
McDonald's and Pizza Hut in India taste different from the ones here. I tried them, yes. I was very disappointed. Sorry. I loved Indian food. By the time I came home, everything I had in India was so fresh and it was so amazing, and the chai was great. And my parents have never traveled abroad. So my mom was really, really sweet. She was like, oh, you liked chai. So she searched high and low. She went to every coffee shop, searched online, trying to find me chai. I was like, it's not the same. It's not the same. I got to just go back and have chai because it's not the same as it is here. Okay, let's go through some quick slides of safe or not safe. Partially. All right. Why is it partially safe?
The coriander or the cilantro on the bread still.
All right. Probably not cooked, right?
Curry food can be sitting for a long time.
Absolutely. Yeah, you don't know how long this has been sitting, right? All right, this is a good one. You guys will all get this one right, I promise. But it looks so good, it probably smells really good too, right? It's street food, right? It's straight off the street. What's safe about this plate and what's not? The avocado, that looks pretty good, right?
But now I'm thinking about the water thing, what's the name was mentioning, so I'm like, I don't think any of this is safe, it's all touching each other.
It's all touching each other too, right? Yeah, where in the world did this come from? That's another question that you have to ask.
Europe or Canada, probably fine.
Not safe, but it's very pretty.
I know, right? It is very pretty. It's safe. But you probably can't take it on the plane with you because they're going to ask if you have fruits and vegetables when you go through customs. Okay? So just be aware of these things too. You got to have stuff in packages, and fruits and vegetables oftentimes will be confiscated. Okay, so again, just a couple more food safety points. If you want to eat fresh fruits and vegetables that do not require peeling, like lettuce or tomato, you're going to have to soak in bleach water for 20 minutes. And this kind of goes through the chlorine bleach per gallon of treated water. This probably isn't going to be an option for a lot of people, okay, if you don't have access. So this is kind of a null point, all right? Okay, water. What did we already say about water? Bottled, okay? Just stick with bottled water. But then think about things like this. You're going to be showering, or what water comes out of the faucet, okay? So when you're in Haiti, because of cholera, it's really critical that you take an extra toothbrush with you, because we all do it, right? We turn the water on, we put our toothbrush under the water. The second you brush your teeth with that water, guess what? Like that's it. You could be exposed to cholera. So make sure that when you're in the shower, you keep your mouth closed. When you're pouring water over your head. And then again, when you brush your teeth, use bottled water.
I can't tell you how many people will be very diligent, and then they'll just be a couple of days in, and they'll be using the bottled water, they're brushing your teeth, and then they'll stand over the sink and go, oh, crap. And then, like, just out of habit, like, rinse their toothbrush with tap water. So the other thing is that's the most common thing that I tend to see in here, and, then you need another toothbrush. Just don't even stand in front of the sink when you're brushing your teeth. I will like stand outside and wait for people. It's like, I look weird, but like that way you don't have that habit of like doing that and pulling out my toothbrush. It's gonna get you sick. But yeah. All right.
So again, just kind of some of the water-related diseases by category. Okay, so I'm not going to read all of these to you, but we all know that there's a lot of risks with water. Okay, we kind of take water for granted. We do take water for granted here in the United States. So I think having the opportunity to travel abroad to a place where water is a precious commodity is definitely a good experience and makes you appreciate it a little bit more. So just be very cautious and careful with water. The other thing I want to say is be careful and cautious with water in terms of where you decide to swim or play. Again, it might look like a really nice pond or lake, but you don't know what's in it. So again, those are other risks that you need to consider. All right, so we talked about this. Don't assume tap water is safe to drink, especially for the brushing teeth and the contact lenses. Don't swallow bath water. Drink bottled water from sealed bottles. And make sure the plastic seal is intact. I'm sure places do collect those water bottles and fill them back up and then sell them again, okay? If that's how you're gonna feed your family, that's what you're gonna have to do. So again, make sure that you have that seal on the water bottle.
So also the water, if there's a vendor that they'll tell you, oh yeah, this shop water comes directly from like Aquafina, Coca-Cola, or whatnot. So what the advice is with the bottles is when you finish using them, to crush them yourself, both to cut down on space, and that way, if they're crushed, like that person collecting them to refill for the family, it's harder when they're crushed because they're smushed versus they're still like elongated.
Perfect.
That might be.
Yep. And then I want to say this for the WHSO trips. When we say to bring your own water bottle, we literally mean that you need to provide your own hard water bottle with you, because they're going to get big jugs of water and they will have them available. So wherever you're traveling to, the jugs will be available. So actually someone on my trip misunderstood that and thought he was going to be provided with water bottles every single day. But again, waste is really a big deal in a lot of places too, and there's not good recycling programs and things like that. So make sure you have your Nalgene bottle, or whatever kind of water bottle you have that you're going to reuse the entire time that you're there. Okay, again, more about water filters and emergency situations. You guys can read this. All right, health and hygiene. Bucket baths. Who's experienced a bucket bath? Half the room. All right, anybody want to share any advice about bucket baths? You put water in the bucket, and then what? And then you shower. It's not always hot water. Yes, important point. Yes.
Isn't it like a rusher thing to pull the water towards the drain when you're done? So make sure you that. Oh yeah.
Okay.
Like 4 squeegee.
Okay. Anybody else have any advice?
You put the hot water the ratio, so you may just take like 1 potful and boil it on the stove so it's hot, and then mix it with the tap water to make it a little more warmer. So you have to really ration it. You just have 1 small thing of hot water for multiple buckets of cold water.
All right, so if we look here at this bucket, right, it's under this spigot, and then there's a smaller bucket inside of it. I've been fortunate the places I've gone where they had both, okay? So one thing to consider in Nicaragua, the last time I was there, it was a really huge bin, and it was about this tall, and they filled it up with water, okay? And then they had a smaller bucket. So I'm like washing my hair, and then if I go to stick my hand back in that big bucket with my soap and suds on it, I just like put all my soap and suds into that big water container that everybody there is expected to use to shower with. Okay? So again, you want to just be mindful of these things. If you haven't had the opportunity to do it, when you get there, you're going to be like, oh, like I didn't think of these things, right? So we talked about it on our trip. People are like, I felt kind of dumb. I'm like, well, you didn't know, and that's okay. But they use the other bucket so that you're not putting your hands in and contaminating the entire water source for everybody. Does that make sense? Okay, I saw a hand up over here. No? Okay.
Also, when you're having your bath, wash your bum bum last. Right? Yeah, so don't wash your bum bum. Then wash your face. Put your hands on your face. So, wash everything top to bottom. Keep your bum bum, wash all the way to toe, then do that last, and then you'll be happy.
There you go. Right. The other lesson that I learned in India was that oil of Olay body wash was not the greatest option, because it had like that oily film on it. So it's great when you're in the shower because you can like rub it off of you as you're in the shower. Yeah, not so much when you're trying to dump the bucket and rub it off of you at the same time. So again, silly little things that we kind of just learn as we go. But I was very proud of myself. In India, we did have a water heater. What ended up happening is we were all waking up at ridiculous hours of the morning to shower. Like we were getting up at 4 a.m. because we all wanted hot showers. So, we had a certain amount of water in the hot water tank, but it got kind of amusing near the end. Okay, don't swallow the water that you're in or on. Be careful about swimming. Again, the infectious aspect. And then avoid contact with fresh water like the lakes, rivers, and streams where these infections can be a problem. All right, some general safety. So talking a little bit about medications, I would encourage you, and I know this was already brought up in the talk that Jeff brought up, but bring the medications that you're gonna need for yourself. If you think you might need Tylenol or Benadryl, make sure you bring your own, okay? Counterfeiting is a big deal. It happens all over the world, but if you have your own medications, then you know what you're taking. You want to buy medications from licensed pharmacies and get a receipt. Don't buy them from open markets. Make sure the medicine is in its original packaging, and then look closely at the packaging, okay? Sometimes things will look strange looking, and it can indicate that this is like a counterfeit product or something like that. I'd also encourage you to think carefully about using different therapies when you're in different places. So when I was in China, it was a beautiful marriage of Eastern and Western medicine. In the hospital that I was in, there was a little girl they were treating for mumps. She had an antibiotic going in, and then she had herbal packs on her neck. And I just thought it was great that they embraced both. They also did cupping in one part of the hospital. I got really sick when I was there. I had an upper respiratory infection. And they said, oh no, you need to take this herbal supplement. Well, I didn't know what it was. The doctor who was there encouraged me, take this. Yeah, well, I forgot about my respiratory illness because it gave me such a bad GI illness. Okay, so again, you need to be cautious because, and I kept the bottle. I looked at it. I was like, who knows what this is, right? But those are the things that they do, and that's what they embrace. And so again, people in my group too got cupping, and people were really impressed and had good outcomes from that. So there are other things that we don't necessarily practice here that might be practiced where you're going. Okay.
One more thing with medication. For those who may be on prescribed stimulants, for example, they're an amphetamine. So that needs to be addressed if they need some legality with bringing it into the country. So just be mindful of that. If your prescription is okay, and the first one that comes to mind is an amphetamine. So just be mindful about that. They need a letter or maybe an original pill container, or what might be required to bring it in safely into the country. So take that into consideration.
Okay, sun exposure. Again, the sun is different in different parts of the world. Okay, so when we say sunscreen, we mean it, because we don't want you to be miserable and have a sunburn the entire time you're on your trip. This is where the fluids comes into play, because we all go places and we don't drink enough water. So this is critical. And you're going to need to make sure that you're wearing sunglasses and wearing sunscreen and wearing protective clothing. Okay. On that same note, know what the weather is expected to be like when you're going wherever you're going to be going, and then prepare for what might, I went to Nicaragua. It wasn't the rainy season, but guess what? It rained every day and every night. So if I had had my boots with me and a rain jacket, I probably would have been way more comfortable that trip. So make sure you're looking at the weather before you're going to go. Know what the season is and what's going to happen. Okay, rabies. So all these cute, fun little furry things. Yes, I missed my dog when I was on my trips, but please don't pet the animals and feed them when you're abroad. We don't want you to risk getting rabies. And unfortunately, we have to worry about the dogs because they don't have the same sort of vaccinations that we do in the US. Okay. So again, we worry about skunks and raccoons here in the US, but in other places we've got dogs, bats, cats. So these are all things that you could come in contact with. Every place I've been they've all had dogs or as pets on the property, either for, just to bark and be a deterrent to people trying to come in, or, so they knew what was going on. So you will find that there are animals all over. They also carry fleas and all of that stuff too. So
Also, when you feed the dogs, they won't bite and really don't.
Good point. Thank you. So leave that to your host or whoever is the owner of the pets. Again, just a couple more slides about rabies. All right, mosquitoes. Mosquitoes can make your trip really uncomfortable. And now we have that extra thing. We got Zika that plays into this in terms of worrying about Zika virus. So I will tell you, I have bought the spray from REI and I sprayed my scrubs. It was great. I think I bought 2 bottles. It was pretty minimal cost. I sprayed them before I went, let them dry in my basement, and I actually did really well. Your mosquito nets are great. Jeff's gave some great advice about bringing floss. If someone throws some duct tape in their bag, duct tape is a wonderful thing. It will get you out of a lot of sticky situations, okay? So I would definitely take duct tape with you. But I would be prepared ahead of time. Now, another thing to consider, when we were in Nicaragua, we got on this little puddle jumper, but we couldn't have any aerosolized cans. So that made it a little bit of a challenge because everybody had these aerosolized cans that we could put in our luggage when we were boarding in Detroit, but then when we got on that little plane, we couldn't take that with us. So again, make sure that you're aware of how you're traveling. If everything is going to be in your carry-on, are you going to be able to take it? So are you going to have to get a different form? Is it going to have to be like in a small spray bottle or a lotion form? Again, these are things I didn't consider, and that's why I'm sharing them with you, because they all happened. And so then here we are with no bug spray, okay? And it was wet.
Yes. So there's a new thing I learned about this, like, when I was on the trip to Haiti this year. Naphtha, you remember what we were all fighting over that we liked so much for mosquito repellent?
Like,
Yeah, man. So it's not even a liquid. It's just, it's like in the wipes. So they sell them like packages, like the baby wipe type things. So you just peel them out. And I loved it. All right, so I went out and got like a couple little packages of them. They're great. So if you're bringing just to carry on, don't want to deal with liquids, that's a great alternative. Yeah, it's it was like whatever, I forgot, Repel, they're mosquito wipes.
Yeah, so I tried one of those wristbands. Yeah, don't waste your money, okay? I've tried all the products on Amazon. Some of like the natural stuff, yeah, that doesn't work either, okay? It might work for some mosquitoes here, but it doesn't work for mosquitoes anywhere else. So make sure you got the real deal, okay? It's called DEET, and it will work. All right, let's see. Use your mosquito net. It's going to make sure that you get a nice comfortable sleep and you won't get bitten, and especially for malaria. So take malaria prophylaxis. And then it says again here, take malaria prophylaxis. Okay, Dr. Kaufman says, take your malaria prophylaxis. I will tell you, a student went to Haiti a couple years ago. Yeah, he came home and guess what he got? Malaria, yes. So again, we need to we don't want you to come home and get sick, right? You had a great trip and then you're going to come home and be ill. So take your malaria prophylaxis, please.
And please, 6 months out, if you get sick and feel flu-like and feel crappy and you go to a doctor and say, I don't know, I feel like the flu, tell them you travel. Please, okay? People get very, very sick. People die from malaria. And usually what happens is that the critical question of, did you travel recently? Yeah, actually 3 weeks ago I was in Haiti. And then it goes missed, and then that's what happens. If you just say, oh, I traveled to India recently, that's usually what a clinician needs to say, oh, okay, I need to be thinking about this. So please, even if you take it, if you get sick, tell them you travel. Okay, that's going to, literally could save your life, could save someone else's life.
but you have to keep the thing day recent.
Yes, recent.
Right? So, like you said, even 6 months out, like this year, and I'm trying to amend my question. Have you traveled this year?
Yeah.
Because, like you said, somebody may forget 6 months. I was there for 2 years. Did you travel at all this year? But if the doctor doesn't ask you that, though, just tell them. Yeah, like you said, don't get fooled by recent. Because that really does mean different things.
All right, thank you. So again, everybody's going to what? That was really weak, you guys. Come on. You have 15 more minutes left. Help me out here. Okay. All right, some illness prevention. Okay, antiseptic hand cleanser. So I was a bright-eyed, bushy-tailed first-year medical student, really excited about my international trip to India during the break between first and second year. Didn't have a lot of knowledge about where I was going and all the different cultural practices, but was very excited about the trip. And we all expected there would be hand soap in the hospital and gloves. And guess what? There wasn't. Okay, so the person who showed up with that bottle of hand sanitizer was like gold. That was our gold, right? So again, you need to make sure that you are aware and you're prepared. So put this on your list because again, you might not have clean water to wash your hands, but at least then you can wash your hands if you're going to be eating and using your hands to eat. So that's where it became a really big problem because we didn't have any utensils and then we couldn't wash our hands. So again, these became challenges. I did just fine, but again, it was a learning and growing experience if you've never had it before. Don't forget your insect repellent, your mosquito net, your sunscreen and lip balm, and then hat, bandana, or a dust mask. So bandanas or scarves are great. It's great because you can get it wet if you're really hot to cool you off. You can put it in front of your face if you need to protect yourself from dust or smells or things like that. So I have a friend who always travels with a scarf on a plane because she's like, if I don't like how the person next to me smells, I can put my scarf around me and that's what I'll smell, you know? And again, these are just little tips. Like you don't know what kind of situations you're going to be in. So, you know, take some Downy sheets and put it on your scarf if that's what you want to smell. All right, personal medical kit, Band-Aid, gauze, adhesive tape, scissors, tweezers, safety pins, some moleskin for blisters, antibiotic, steroid, and antifungal creams, and then feminine sanitary supplies. So I'll tell you personally what also goes in my personal medical kit. Well, we'll go diarrheal treatment. You got your malaria prophylaxis again, acetazolamide, which we touched on if you're going to go somewhere in high altitudes, pain medications, respiratory treatments. If you're an asthmatic, when I was in South Africa, buying an inhaler, an albuterol inhaler, was a lot of money. So if that's something that you need and you anticipate that you have asthma, you should come prepared with those things because one, you might not be able to find them, and two, they're going to be extremely expensive. Motion sickness treatment, and then personal chronic and rescue medications. So my point before, I always travel with an EpiPen. I don't have an anaphylaxis to anything like that, but it is the one thing that I can have that if someone is having an anaphylactic reaction, I've realized like there's nothing else that can be done for them except administering an EpiPen. So again, just something to think about. I've learned this along the way. I was on one trip with the WHSO students, and God, I love you guys, but there were 4 of you on the trip that all had some sort of anaphylactic reaction and then proceeded to say, here, will you carry my EpiPen? And I was like, no, I'm not your parent. I'm not going to carry your EpiPen, but you need to have that with you, okay? Because you don't know, again, what you could potentially come in contact with, okay? Latrines. Everybody's favorite topic. This is where your scarf might come in handy or your bandana. Okay, so again, Western toilets aren't everywhere in the world. And these are an example of some of the places where you might have to use the bathroom. I should have put a picture of, in Nicaragua, we helped dig some latrines, and I showed my niece a picture when I got home, and she insisted to my sister, she was like, Aunt Amy's joking. She's just pretending. And my sister's like, no, Addison, that's real. That's where she had to go to the bathroom. So again, like if this is not what you're used to, this is something different. So just kind of knowing what the situation is going to be like prior to going. Take toilet paper everywhere. It will likely not be provided. And for indoor latrines, put toilet paper in the wastebasket. So again, a lot of their systems cannot handle the toilet paper. And so make sure that you ask when they get there. When you get to your destination, they'll be pretty good about telling you and letting you know what the expectations and the rules are. I kind of laugh at the first statement because when I went to China, we all packed I was going for a month. I was like, okay, packed some toilet paper with me. We get to China and we're pulling our suitcases and we're walking on the street and you could buy anything you needed on the street. So the first place, right before we get to our apartment is there's piles and piles of toilet paper. So that was kind of the joke. We were like, well, I guess we really didn't need to pack toilet paper because we were able to find this pretty easily, but pack it anyways, right? Exactly. It will come in handy.
But also, some places, there's someone outside of the rest area that has toilet paper, they're going to charge you a lot to take it from them.
Did everybody hear that? Did you guys hear that? Can you?
Scam my toilet paper humans outside of rest area.
So sometimes people will be sitting out there with toilet paper because they know that you won't have it. They'll charge you large sums of money to use the toilet paper.
I mean, they will charge you like an arm and a leg and like make a scene and bring your own, carry your fanny pack, like don't even stress about it.
Okay, traveler's diarrhea. We kind of touched on this already. Basically, the bacterial toxins generally cause symptoms within a few hours. The bacterial and viral pathogens can have an incubation period of 6 to 72 hours, and the protozoal pathogens usually have an incubation period of 1 to 2 weeks and rarely present in the first couple of days of travel. So, one thing I really emphasize is make sure that you let someone on your trip know if you're not feeling good or you're not okay. I think that's really important. We had someone who didn't say anything, and the next thing you know, we're like, where are they? And they're sick in bed because they've had diarrhea for 2 days. So it's important. You don't have to share your business with everybody in your group, but make sure that someone is aware if you have any medical conditions, if you have a history of seizures and you're taking an anti-epileptic medication, or you are that person and you have to carry an EpiPen because you have severe anaphylactic reactions. It's really important someone in your group is aware of these things, okay? Let's see. For treating traveler's diarrhea, if mild, no therapy, or loperamide, plus the oral rehydration fluid. If it's moderate to severe, you're going to want to consider getting yourself on some Cipro. So again, when you go to your travel clinic, I encourage you to ask for that prescription and just have it available. And then Azithro for children, pregnant women, and if treatment failures if acquired in Thailand. And here's some examples of oral rehydration salts. On some of the trips I've gone on to, people have taken like the oral rehydration packs, not necessarily like the WHSO ones, but just the oral rehydration packs because they're not drinking enough water. So they add it to their water. So that's something that you'd want to consider as well. So you can get like the Gatorade or whatever, it's got the sugar in it.
Usually super cheap. Yeah, those are pretty reliable.
Okay, if you require medical care, the U.S. Embassy in your destination can help you. Your travel insurance website will likely have recommended locations in your destination country, and be sure you have your insurance information with you. Okay, so here's my big vacation story. I decided I was going to take my dream vacation, and I always wanted to learn to surf. So 2 years ago, I decided to take a trip to Costa Rica for a surf and yoga retreat. Super excited. All of my friends are at different places in their life. Like, they have families and stuff. I'm like, whatever, I don't care. Nobody else wants to come. I'm going to go by myself. I'm going to go on this surf and yoga retreat. I had a great time. I met some amazing people, was having a ball. Thursday morning, we had early surfing that day, and we had instructors, and actually I kind of got the hang of surfing. I was pretty proud of myself because it was pretty cool. And I know too much because on the board, I just fell off the wrong way, and I was like, oh, I think that was just my ACL. I really think that was just, I think that's how it feels when you tear your ACL. So I fell off the board. I was in shallow water, and I was like, okay, something bad just happened. Tried to stand up, and I couldn't stand up because my knee was just not stable in any way, shape, or form. So they got me off of the beach, and all the surf instructors are like, oh, it's not swelling up. You're going to be fine. We're going to have you back on the board this afternoon. I was like, yeah, no. Something's not right. So I did listen to my mom, and I always buy travel insurance. So I ended up tearing my ACL, my MCL, my lateral meniscus, you name it. I totally blew out my knee on this trip. So I still had 3 more days left. So first off, I couldn't walk, so I needed crutches. And the place I was staying, couldn't help me out. I needed a brace. So with the travel insurance, I notified them right away. They sent me a list of all the clinics that I could go to. So I had to show up at this little clinic in Costa Rica. I told the doctor there that I was a physician. He picked my brain for a half hour about asthma therapies for kids. And I was like, why are you going to charge me now? I just gave you more information. He made me aware that there was really nothing he could do. So he was like, well, what do you want me to do? And I was like, well, crutches and a brace would be nice because I'm going to be going home in 2 days. So he said, yeah, if you want an x-ray, we can send you over to the vet across the street because we don't have any x-ray machines. So I was like, great. He said I could get you on a small plane and get you, back to, a big city. And I was like, no, I'm going home. I know what's going on. So, and it cost me $20 because they had to have an ambulance pick me up Their ambulances, they're a little bit different. So if anybody is going to have a heart attack where I was in Costa Rica, you weren't going to make it. So again, these are things to consider. It's a beautiful place, but if you have any health problems, this is not the place to be. So I ended up being unable to walk, and I was able with my travel insurance to get like upgraded, because when I wasn't traveling with anybody. So when I got to the airport, like I couldn't walk. So they moved me up to first class because I couldn't bend my knee either. So any sort of movement and things like that was really a bit of a challenge. So I wanted to say, like, at the end of the day, all of my money got reimbursed for all of these things. Like, that's what travel insurance is for. So make sure that you, like, I always laughed at my mom when she was like, oh, you need to get this travel insurance, you need to get this. They were very, very helpful. And let me tell you, I knew what was wrong. It wasn't a life-threatening injury, but when you're somewhere else and you're by yourself, it's scary. It's really scary. I was in a lot of pain. I did have Motrin and Tylenol with me. I could have used some other drugs that would have been helpful, but I didn't have access to any of them. But all the surfers were like, oh, no, you'll be fine. You're going to be back on the board tomorrow. And I was like, oh, I really wish that was the case. But again, I can't emphasize that enough. Like, it was an accident. It happened. So just make sure that you're prepared. And these things are helpful. And in the end, they will help you out. All right, just a couple of quick cultural considerations. Wear clothing that's appropriate for your task. Cool wicking when you're in the heat, not too revealing. Again, be aware of what's culturally acceptable. Different places, different things are acceptable. Shoes that are going to stay comfortable. And then layers when you're changing weather or altitude, and then sun, dust, and bug prevention. Okay, we're almost at the end, guys. So miscellaneous. For women, take enough tampons and pads for the duration of the stay. Access to these items can be really unpredictable. Safety. In several countries, a woman at home alone allowing an unrelated male visitor in the house is considered equivalent to consent. So again, you need to know what the cultural expectations are in the places that you're traveling. Use condoms for sexual activity. Approximately 80 countries still criminalize LGBT relationships in some way. So again, these are all things that you need to consider before you go.
For the top on the feminine hygiene stuff, sometimes it's hard to like get rid of the used products, so like 80/20 for the toilets and ground. Last time when Christiana, Jeff, and Erica gave the talk, they talked about issues with reusable menstrual cups or reusable pads. That's something you're comfortable with or into, you might find yourself with a little better situation in terms of the waste production and then ability to keep out.
And I mean, again, make sure it doesn't end up in their latrine or their toilet. And it's probably not a bad idea to let somebody know too, because a lot of times they incinerate some of these products too. Okay, carry a small amount of local cash. Don't display your money or valuables. Have a copy of your passport. I think Jeff's idea is great, having a digital copy. I actually give someone here in the US a paper copy of my passport. And then I also make sure that I have a copy in my carry-on and then in my suitcase or something like that, so that they're separated in case something is to get lost. The worst thing is to be spending your time traveling to the embassy to see if you're going to be able to get another passport. Stay alert for dangers like dogs when you're running, using the buddy system. Avoid danger areas and time periods. So one thing I want to emphasize is, again, we get excited when we go someplace else, and sometimes all of the inhibitions get lost, and I'm in this other country, and this is really fun and this is cool. You need to be safe. Okay, and the rules that we have in the United States don't always apply to places abroad, okay, in terms of criminal activity and things like that. So again, we want you to have a good experience, but you need to keep your head on your shoulders when you're there. Don't fight to protect what can be replaced. Call out early for help. The one thing I will say is no travel in groups. One thing that happened in India is I was never allowed to go anywhere myself. By the end of the trip, I was like, I don't want a buddy. I don't want anybody. Like, I want to go for a run by myself. And they're like, no, you can't go by yourself. So again, understand and recognize that that's just the way it is for the trip, and then accept it, okay? All right, that's all. Anybody have any questions or comments? I thank you all for your attention and for all the input and insights everybody added. If you have other questions, I'm available. So at this time, it's exactly 8 o'clock, so we're on time right now. So what we're gonna do is we're gonna break you up into your capstone groups. So what we'll do over on this side of the room is have the WHSO students meet over here, and then the other capstone groups, if you kind of want to divvy up over on this side of the room, so you have the chance to talk about your project, because we have some upcoming assignments due, and we'll work on that until 8:30, and that will be it. All right, thank you again for your attention tonight.
Pause the guy.